So radiation therapy can be used to cure bladder cancer and is an alternative to surgery for some patients with localized bladder cancer. That's where the cancer hasn't spread beyond the bladder or the lymph nodes in the pelvis. This type of treatment is called curative intent radiation therapy, or sometimes called bladder preserving therapy, and it is usually given in combination with chemotherapy or other drugs that help make the cancer cells more sensitive to radiation therapy. For patients who are very unwell or whose cancer has spread more widely, radiation therapy can also be used to help with symptoms or control pain that's caused by the cancer. This is called palliative radiotherapy and generally involves much shorter courses of treatment and lower doses. The palliative radiation therapy can be directed at the bladder itself for symptoms like bleeding or pelvic pain, or it can be delivered to other sites in the body, such as for bony pain if the cancer has spread to bones or other sites in the body. Bladder preserving therapy may be used as an alternative to surgery with localized bladder cancer who are unfit for an operation. It can also be used for patients who are fit but who want to attempt a bladder preserving approach. Ideal candidates for a bladder preserving approach are patients with a small or early stage invasive bladder cancer. It's also best for patients who have good bladder function at the beginning of treatment and patients who are willing to attend for regular follow-up. There's never been a trial doing a direct comparison between surgery and bladder preserving therapy. However, modern series of people who have had radical radiation treatment with chemotherapy or radiosensitizers actually show overall survival rates which are similar to historical surgical series. Of patients who do opt for a bladder preserving approach, 70% have a functional bladder 5 years after treatment. About 1 in 10 patients do ultimately go on to have a cystectomy, either due to residual or recurrent disease, or if the function of their bladder after treatment is not optimal for their quality of life. The side effects of radiation therapy vary from patient to patient. Short-term or acute side effects typically develop in the second half of treatment and can get worse the first week or two after treatment finishes, and then start to improve over the next 4 to 8 weeks. The common short-term side effects are feeling tired and irritation of the bladder, where patients find that they need to go to the bathroom to urinate more often or more urgently, where they don't get as much notice that they need to pass urine, and sometimes some discomfort or burning when they urinate. We're able to help patients through this with some medications that make the urine less acidic and encourage patients to drink plenty of water, particularly early on in the day, provided that they're not on a fluid restriction for heart problems. Some patients also get some abdominal discomfort or some diarrhea towards the end of treatment. And again, we can help them through that by the use of low fibre diets and occasionally some medications to help reduce the number of bowel motions. Patients are often worried about redness and burning of the skin. With modern treatments for bladder cancer, this is usually very mild, if at all. However, we do tell people how to look after their skin with basic moisturisers and loose clothing, and we regularly monitor their skin during treatment as well. Patients are often also worried about losing their hair. They may lose a small amount of pubic hair, however, it won't affect the hair in other parts of the body. So most short-term side effects resolve within 3 months of treatment, but some patients find that they do have more persistent or permanent side effects, and we call these long-term or late side effects. 70% of patients don't experience any long-term side effects following curative radiation treatment for bladder cancer. 10 to 20% of patients experience mild long-term side effects that don't require treatment, and 1 to 10% of patients experience more significant long-term side effects requiring further investigations and further interventions. Some of the common long-term side effects are permanent changes to the bladder or the bowel function, so needing to go to the toilet to pass urine or pass bowel motions more frequently or more urgently. Some patients experience some bleeding from the back passage when they pass a bowel motion, and if that happens again, there are further investigations and management options for that. Some patients experience chronic swelling of the legs, and this is also called lymphedema. It tends to only occur in patients who have had treatment of the lymph nodes in the pelvis as well as the bladder. And for patients who are having treatment of the bladder alone, it is relatively uncommon. For women who have yet to go through menopause, radiation frequently causes premature menopause, and some women may benefit from hormone replacement therapy to help them with the symptoms of this. Women may also experience some dryness and long-term shortening of the vagina, which can interfere with sexual function, and this can help to be prevented by the use of pessaries and vaginal dilators. Men usually don't experience any hormonal effects from radiation treatment, but can experience erectile dysfunction and reduced sperm counts. The erectile dysfunction can be assisted with various medications and other interventions to help with erectile function. And for patients who are yet to complete their families, we would be able to offer sperm banking for patients prior to starting radiation therapy. Uncommon long-term side effects from radiation therapy would be incontinence or leaking of the urine, where patients are unable to control their bladder and need to wear a pad. It would also be uncommon, but some patients find that their urinary function is so affected by the radiation treatment that they would actually prefer to have a cystectomy after radiation treatment, even if the bladder cancer has been controlled. And finally, a second cancer developing because of the radiation treatment is a rare but real potential late side effect, which generally would take many years after the radiation finishes, but is something that we would need to monitor for and particularly consider for younger patients. Most patients will develop some short-term side effects during and shortly after treatment, but the majority of these resolve within 3 months. About 70% of patients experience no long-term or chronic side effects from radiation treatment, but 10 to 20% of people will have some mild long-term side effects that don't require any specific interventions, and 1 to 10% of patients will have more significant long-term side effects needing further investigation and management. So after radiation therapy finishes, patients will be reviewed at regular intervals by their radiation oncologist or their radiation nurses to make sure that if they are experiencing any side effects, we can help them through this. For patients who have had curative bladder cancer treatment for localised disease, we arrange for them a cystoscopy, usually about 12 weeks after the radiation finishes. That's where the urology doctors will insert a small camera up into the bladder to make sure that the bladder cancer is responding to the radiation treatment, and also to monitor for any new cancers developing. And those cystoscopies would be arranged at regular intervals after the radiation treatment. It's important to have those follow-up checks because if the cancer was to recur, or if a new cancer was to develop and if it's caught at an early stage, patients are often able to have an operation still aiming to cure the bladder cancer, and we call that a salvage cystectomy. People often ask if they are able to have radiation therapy more than once. There is a limit to how much radiation treatment any one particular side of the body is able to receive. For patients who have had high dose curative intent radiation for localized bladder cancer, we do generally try to avoid giving the bladder more high dose treatments down the track. However, if patients have the spread of disease to other parts of the body, radiation is able to be given to other body sites. And if patients have had low dose treatment for symptom control, that's often able to be repeated. So patients will be reviewed by their radiation oncologists and their radiation oncology nurses very regularly during and after their treatment, so that we can help them with any symptoms that they may be experiencing. There's other support available to patients at most centres through cancer care coordinators who help with the logistics of treatment, particularly for patients who are having more than one kind of treatment at once. We can also get help from oncology psychologists who are often helpful with dealing with the emotional needs and coping needs of patients going through treatment. Some patients benefit from seeing dietitians or other allied health professionals, and many patients actually like to speak to other patients and families who have experienced bladder cancer, and this can be facilitated through organisations such as BEAT or through the Cancer Council.